Hello, my name is Mohan Nagarajah. I'm a respiratory and sleep specialist. Today I'd like to talk to you about sleeping and particularly the issue of difficulty sleeping. It has been said that sleep is the best meditation. It is important to have a good night's sleep to feel refreshed and energized in the morning. Sleeping will enable you to remain alert. Sleep should be at night rather than in the daytime, though sleeping by day may be unavoidable if doing shift work. There are many consequences of not having a good night's sleep. The lack of energy can be profound. Daytime sleepiness is a risk factor for having microsleeps at the wheel of a car and for having a car accident. It can affect memory and concentration with poor performance at work and with studies. Poor sleep can also lead to depression. It should be noted that depression can also lead to a lack of sleep or excessive sleeping. It is important to give yourself the opportunity to sleep for at least 7 to 8 hours each night and to give this priority. This can be difficult, for example, for a new parent due to sleep disruption from the baby. There has been a recent trend to sleep less due to the competing demands from electronic devices and games. It is important to set boundaries in your work life and social life. Insomnia is the medical term for difficulty falling asleep or difficulty remaining asleep at night. Insomnia can be a short-term issue, for example, due to a recent life event such as unemployment, or it can be a more chronic issue. Many medical conditions can lead to having a poor night's sleep. Prostate problems, for example, can result in having to wait many times to empty the bladder. Poorly controlled diabetes can also have a similar effect. Poorly controlled asthma can result in the need to wake at night due to cough or difficulty breathing. There are many other sleep disorders that can lead to poor sleep and disrupted sleep. It is best to avoid stimulants such as caffeine, chocolates, or cigarettes before bed. It is important to note that it is not only coffee that contains caffeine, but tea contains caffeine too. Some medications can make sleeping difficult. Prednisone is one such medication and is best taken in the morning for this reason. It is important to have a regular sleep-wake schedule. Daytime naps can make it hard to sleep at night. Napping should not occur in the later afternoon, and if insomnia is a problem, then it is best to avoid daytime naps altogether. The bright light from smart devices or the TV can contribute to insomnia, as the mind is confused whether it is day or night. Avoid large meals close to bedtime and do not look at the clock if your sleep is interrupted. Excess fluid intake prior to bed can result in the need to get up to empty the bladder. The old adage, sleep only in bed and use the bed only for sleep, is true. Sleep should only be in bed and not in other places such as the sofa. Using the bed for sleeping and not for reading or listening to music will make it possible to program your mind to allow sleep when in bed. Successful treatment of insomnia can take several weeks to months. The first step is to see your doctor and to determine if there are any medical issues or medications that could be affecting your sleep. Adequate treatment of depression is likely to improve sleep quality. Treatment of prostate issues may reduce the need to get up at night to empty the bladder. Optimal control of asthma should result in sleep not being disturbed due to cough. Excessive use of Ventolin, on the other hand, to treat asthma can also lead to insomnia. Avoid coffee or tea or a meal 3 to 4 hours before bedtime. This can be beneficial in treating insomnia. Not using smart devices immediately before bed or in bed will help program your mind to understand that it is time to sleep. Cognitive behavioral therapy by a psychologist can be a very useful treatment to treat insomnia. Medications to treat insomnia are best avoided due to side effects. Herbal medications such as melatonin can be used for short periods of time. Benzodiazepines are a class of medications that include Normocin and Valium. These medications are addictive and can affect alertness and cause daytime drowsiness. These medications should not be ceased abruptly and should be reduced slowly over time. Please consult your doctor for further advice, and I hope you have a good night's sleep putting into practice the outlined strategies. Thanks.